Good morning, everybody. Can you hear me okay? All right. Um, Thank you, Tony. Thank you, Andrea. I feel like I could just sit up here all day and listen. And yeah, I feel like both of you have made my work to be up here and offer some what might seem provocative for us is just our lived experience. Um, Thoughts, comments, offers, recommendations. Um, I do want to start with just when we did the check-in around kind of how we're feeling about equity, what I offered was I'm just feeling really tender. And really, I feel this morning in particular, just really holding a lot of grief for the young people that I work in service to, for the communities that I'm a part of, for my family. And it's grief that's generational, historical, acute. It's all of that. And so my voice might waver a bit today, but I want to offer that as if you're in that place, please just, this is for all of us. There's room for all the feelings and all the ways. So just, I appreciate you holding mine while I hold yours. So I work in Richmond, California. We're about 8 miles north of Oakland. Um, and the way I will describe our community is immense fortitude, beauty, resilience. We know how to have a good time. We know how to laugh. And it's also a community that is overly surveilled, under-resourced, overly problematized by the systems that all of us in this room are a part of. We are primarily a community of color. Primarily the leadership of this city is white. Our mayor has made it clear he's not interested in young people as much as we go to them and code switch to make the leadership comfortable with what we need and want. So just to paint you a picture of the atmospheric trauma and violence that we live in and continue to show up every day with love, hope, and rage. What I'm going to share is our approaches, our tenets, and try to provide some examples of what it looks like on the ground and in practice. We are a youth organization. We work with young people ages 13 to 21-ish, a little bit older as well in some cases. We provide a multitude of services and programs. We have probably today like 30, 40 programs across community health, education and career, youth justice, youth organizing. There's a lot going on in the space, and I would love to host any and all of you at RYSE when you make it to Richmond if you haven't been there already. So we are a space. We are a safe space for young people. It was born out of young people organizing to change the conditions of violence in their community, to get adults to get off our asses and do some work to really be in service to and be responsible to young people. And it was a long lens. It started in 2000, we opened in 2008. So the young people who organized for RYSE did so knowing they would never benefit from the actual services and programs. They were thinking about legacy, about 7 generations ahead of them. And so it's in this spirit that I honor and offer what I have to share. And if you hear nothing of what I have to say, there's one question I just want to pose, or one thought, and that is, as we're talking about population health, about the potential, the opportunity for how we really look at social determinants, as we look at indicators, that if we continue to identify equity, population health, and determinants within white, middle class, overeducated subjectivities, will continue to be culpable. So if equity is still about being good white people, we are not doing our job and we are causing more harm. So if there's anything you hear and anything you can sit with as we go through today, that's what I would want to offer and ask us to really sit with. And as we look at our own practices, investments, assumptions, work from there. So RYSE is a public health organization. We are proud of that. And in all transparency, I am trained in public health, overeducated brown girl, child of immigrants. So I definitely sit in that, and I think that's important to share. We are certainly grounded in the ecological model of health. So we understand Health is about, again, where we live, who we're around, what schools we go to. For us, we're really clear, though. Oh, my clicker, thank you. Is that we are really focused on, even in our direct services, changing systems, changing culture, changing the narrative. So when our therapist, our case manager, our studio manager are engaging with young people, that relationship is based in validating the experiences, the fortitude, and the harm of systems. And we work from a place of, we're certainly a trauma-informed organization. We have been before even that was a popular term. We really come from the place of when young people walk through our door, we tell them we're really happy to see them, and we ask them, how did you get here? How can we make it easier to get here? We don't ask what's wrong with you. We don't even ask what's happened to you. We appreciate that you are here and you trust us enough to be here. How can we make it easier? And then I think, culture shift, again, we're talking about the narrative. So one of the key things when we talk about violence in our community, and similarly, Richmond is on the FBI's most dangerous cities list, somewhere around the top 10 all the time. I think we're not on it this year, but that's because we didn't submit the police department didn't submit the data, not because, so let's be clear. So when you see the mayor talking about how we've reduced violence, So one of the things, though, that we hear from young people over and over again is that the narrative of the dominant media about who young people in Richmond are feels just as violent and harmful as interpersonal conflict they have with each other. So when we talk about the ecological model, that's the piece, where are we actually intervening? The media. And so I want us to think about, as we think about health, as we think about healing, what can be our approaches, investments, advocacy, agitations to really shift the way and hold media responsible, because they have to be responsive to us. So I think that's important to name, that interpersonal violence is a symptom, a manifestation of structural violence. And sometimes for us, the question is, damn, we're actually surprised there's not more interpersonal violence given the level of dehumanization and subjugation our communities live in. Social determinants of health, all about it. For us, it's about really understanding structures, the relationships between structures of dis-ease. And how do we then understand, name those legacies of those structures and their relationships to then shift, again, the conditions of health, healing, justice, equity, and liberation. Again, if equity and optimal health is still based on what it means to be compliant middle-class white people, we are doing harm. And I'm not saying this from a place of, this is just something we thought about, in our management meeting. This is lived experience, collective experience. And we code switch really well at RYSE. So you'll see me in another way I talk about this. We know who our audiences are. The young people know very well. So I also want to offer that. It's not coming from a place of high theory. It is really grounded in the lived experience and the praxis of understanding the structural forces. We are a racial justice organization. We are an anti-oppression organization. Our racial justice work is really grounded in intersectionality. So understanding there's multiple movements and intersecting movements for liberation. So we are a queer justice organization. We are a gender justice organization. And for us, again, it's also about really lifting up the histories and legacies of resistance to immense subjugation and violence. That we are still here, we are still talking, we are talking to you, that we're actually able to engage in a civil way is something very profound. Again, given the level of dehumanization we live in every day. A story I'll share is we run a hospital-linked violence intervention program, and we have a contract with our local hospital, the trauma center. So a young person gets shot, stabbed, assaulted, they go to the hospital, they get consent for us to come and do bedside visits. The police show up, and right away, they ask, who did it? What do you know? You have 14 bullet holes in you. You are in complete shock. You don't know what's going on around you. The hospital's 24 miles from Richmond in an affluent white community. So the staff there, you can't relate to them. 70% of the times when we apply to victims of crime services, which is rightfully their resources, they are rejected because the police report said they were non-compliant with 14 bullet holes in them in the ER. So what we get told is, well, can you just tell the patients to say they don't know, because that'll make it easier. Easier for who? So again, in our work with young people, we could say that, right? That could actually be the easy thing to do, to say, you know what, just say you don't know. Actually, no, you need to wait, Mr. Officer, Ms. Officer. The victims of crime, why do we even need the police report number? We don't need all that. So our work is to really share these, again, lived experiences, and really elevate how the systems get in the way and perpetrate harm. That is our aim. So while we understand behavior and outcomes and individual health indicators are important, our focus is on changing the systems and conditions. Because if we solely focus on behaviors and only behaviors, we continue to replicate the systems of oppression, inequity, and dehumanization. And again, liberation is our aim. So equity, yes. Again, it depends on how it's defined. So I'll take back the yes. It depends on how it's defined. Liberation is our aim. And that means some of us have to give stuff up. And that means some of us have to step in to places and opportunities and responsibilities we might not have thought of before. We're really fortunate to have a solid and strong relationship with the endowment. They were an investor and supporter of RYSE before the Building Healthy Communities initiative. And we will share, it has been healthy struggle. We engage in a lot of healthy struggle with our partners and our stakeholders. And one of the things as an organization we understand is that if we only meet our grant objectives and deliverables, we have not succeeded. We have failed our children. We have to be bigger and bolder than our logic models, than our theories of change, all of that. It is not enough just to feel like, oh, I completed that grant report. And I'm good at that. I'm real good at writing grant reports and proposals. So I say that again in that vein. But again, want to push us to think about there's no indicators that can actually really evoke what it means to feel liberated. We are an organization that understands the importance of data. It is what allowed us to do what we do in a community and in a time when we opened our doors where there was a lot of resistance. It was the data from the local public health department, from our public health foundation funders and investors, from others about saying, look, this is what's going on in the community. But it was really young people who drove us to think about data and learning in a really different way. So we identify as a learning organization. We also know, and I think this is in line with logic models, theories of change, is that we know what conventional social science research has done to Black and brown people in this country. And what it does to white people in this country is it separates the spirit and the heart and the mind. So we're really good at staying here, but we live here. And so, and we live in that integration. And so while we, are informed by those kinds of data, we are interested in conflating factors, right? So some of you might know, we're playing with this idea of really understanding a syndemics framework of research and data. So how do we conflate factors to really understand the synergy and the relationship versus conflating and doing regression analysis? So how can I keep stripping myself of my experience to then meet a neat and tidy indicator or not meet it? Our work is to really ensure that the needs, priorities, and interests of young people of color are invested in, are understood, that everything we do leans towards that, because we really believe then everyone will be better. And by better, I don't mean everyone feels happy. I mean everyone has what they need, but that means some of us have to give some stuff up. some of us have to give in. If you go to our website, and I think we have a couple videos that are in the resources, so I'd love for you to just check out what it looks like at RYSE, because I'm an adult at RYSE. I'm one of the OGs, and I am. And so I do my best to speak truth to the power of young people. But I also know that there's just nothing that can replace it. So I would really ask that you take a look at some of the work the young people have done, because that's really where the stories are. That's really where the opportunity for transformation is. And then, cross-sector collaboration, resource cultivation. What we often remind our public system funders, our foundation funders, our investors, our donors is that the money we get to do what we do is our young people's money. So the endowment, it's in a system and in a place, but that money, those resources are our young people's. We are stewards of those resources. So we have to be responsible for that. But I think that helps us then be in partnership with our funders and our stakeholders in a different way, because then it requires all of us to be responsible. It's not just about TCE being then responsible for it. I have to be responsible in a certain way as the one who writes the grants, the proposals, who code switches and translates. And again, being able to name that is really the first and the enduring place that we have to be, that any concentration of wealth or resource, the legacy of it is structural violence. It is the subject, this country is founded on it. It runs through everything we do. So the narrative of lifting that up is again, really critical. And I think that's why we've been really thankful and fortunate that the endowment and even some of our other investors and stakeholders are starting to understand how we name stuff, how we talk about it, who talks about it, is just as important as providing a bus pass. That they are connected. So I will stop right there. I don't even know how much time I've taken, but I hope this is helpful. And again, just hope that we can really marinate in the question of what the baselines of equity and liberation need to look like in our work. Thank you.